Okay, welcome, my friend. If you already included in our TikTok friend list, we already say welcome to you. Thank you very much for your attention. If you're Facebook to our friend, we say to you welcome our channel, and YouTube. If you're our subscribers, we already said and welcome. If you're not to, we encourage you to do that right now. Go to our channel. We're going to send the link to you, and then you can just open the YouTube, and then go to the website and open the channel, and you will see some button in the bottom of the page. Just click on it. It becomes like a little bell picture, like the photo cloche. You can click on it, and then you will be subscribed automatically, and you will be able to watch any kind of video we have on our channel. So today, my friend, we just come in to talk about the diabetes. Diabetes is a really disease actually that affect at least between 11 to 12% of American population. You know that. When I said between 1 to 12% of population, I just mean between 11 to 12 individual of any single, every single, I said 100 American are already diabetes. That really catastrophic, horrible, but that's true. Although United States is one of the country who has, enough capability, economic resources, whatever, human resources to stay in control of any kind of disease that affect the population, but he's still out of control of diabetes. Diabetes is included in the list of a lot of other, metabolic disease. The term they said endocrine disease. Endocrine disease means any kind of medication, any kind of disease that can affect, the endocrine system. Although they call it metabolic disease, especially diabetes, hypertension, and high cholesterol. However, before we start talking about the diabetes, but let's describe to you just in a few words what exactly is, diabetes. Diabetes is just the incapacity or incapability of the kidney to control the amount of the blood glucose, you see what I'm saying? The amount of the glucose across the blood in other terms in the organism. That means the kidney cannot control the amount. The problem is linked to many other causes. You see what I'm saying? That means the total insulin of the organism is a little bit too small. You see what I'm saying? To burn the glucose. This is the problem. What happened? When you said the incapacity of kidney, mean the kidney still work, but he cannot to control of the amount of the glucose in the blood, because some problem quelconque, it should be body cell impairment. As we use body cell impairment, mean any body cell that has responsibility or function to control the insulin, or the insulin has capability to burn, if you want to use the word burn, to burn the amount of the insulin, the glucose across the organism. That's what I mean exactly mean. I mean the insulin is have for function, you understand, to burn the glucose, to keep the glucose level balanced across the organism within the blood. Now what happened? If that happened, now you have high risk to become a diabetes. What we come to talk to you especially today, we don't come to talk a lot because we don't have enough time for that. We have short time to do that. What we tend to talk to you, we talk to you about how to manage your diabetes. Meaning, if you already diabetes, how you can manage your diabetes to avoid, the situation get worse. If you're pre-diabetes too, you have more chance you can manage your diabetes. You never become, a true diabetes. Meaning what I mean, you when you're in the diabetes, this is pre-diabetes, excuse me. This is the term they use in English to talk about then individual or some individuals that are at high risk to become the diabetes, but they are not diabetes yet. Do you see what I'm saying? So at some point, if you, when myself, to be honest with you, I'm at pre-diabetes as well, but I have capability, I have enough, skill and experience to manage my the pre-diabetes. I never become diabetes, while it's turning to 7 years. To show you, we still have a chance to control your diabetes for not becoming a diabetes. First thing. The second level, as we want, when you think about the two, that's in the percentage, excuse me, of the diabetes across the United States, it's close to 37 to 38 million. When the 37 millions, I mean, that's a lot, close to 12% of the 330,000. You see, 330 million people for the United States, but that's what, the 31 million represent, between 11 to 12%. So now he has capability. He has enough, economic resources to manage the disease in the country. Even that, he still have problem to stay in plain control of the disease, especially 100% control of the disease. So now we don't need to tell anything about Haiti, even though we would like to focus our our advice, whatever we want to do right now, or education. We want to focus our education to Haitian people, like any other country, like poor countries, like maybe some African countries in the African continent. You maybe some small country like Dominican Republic, like maybe other countries in the Caribbean countries. So all of them can really have problem to manage diabetes because of lack of economic resources. That you know that. But what we come to talk to you especially today, to tell you, according to some deep studies, we can manage our diabetes or pre-diabetes step by diet, a lot of other things that too, but while we encourage every single diabetes to manage their diabetes by taking their medication on time, but we still need to encourage you to get more education about diabetes, how to manage it, if you are pre-diabetes, if you are diabetes, if you are not diabetes yet, depending your age level. Remember, diabetes management is a step-by-step process. Meaning, the diabetic management vary from individual to another individual. Or, in other terms, or otherwise, the diabetes management vary according to the age level of the individual. When the age level mean there are some method you can use to manage diabetes at age 20, you can need to use it at like 60. While diabetes type 2, we just remind you, is a metabolic disease that affect most likely individual don't their age level is over 40, between 40 to 65. Some other individual lower than 40, maybe under 30 age level can be affected by by diabetes, but it's not really age high level percentage. It's maybe very low level, maybe 1 or 2%. Now, what we can say, our advice regarding the diabetes, especially diabetes type 2, if you already diabetes, what you can do. Diabetes is not really something like, the disease that can kill you quickly. If you manage your diabetes, even if you're, a diabetes, you can manage it and you stay, nothing, is decreased, from your lifestyle. Do you understand what I'm saying? That means you can continue to be, to have a normal life, a good health condition like any individual, even though you still diabetes. You can first thing. This is what the deep study prove today. You can manage your diabetes by only diet and other kind, of precaution. Learn the diet mean what kind of ingredient you put. Excuse me. What kind of ingredient you put you to make up your diet. Second thing, more important, fundamental one, the more, I would say, efficient one, when the more efficient is exercise, especially physical exercise. That means you can manage your diabetes 10 times better, as I said, repeat it, 10 times better with exercise and diet than medication. While we still encourage you to take your medication, depending what kind of treatment your healthcare providers try to oppose for you to help you with your diabetes. For example, if your doctor prescribe you insulin, any kind of insulin, lent, extra lent, maybe long active, fast active, whatever kind of insulin they use to do your treatment. There are so many different kind of insulin, you know that, as you know. So even they can combine your insulin therapy with some other pill, like oral pill, like maybe metformin, gluburide, something, whatever they use. You can all of that take your medication. But if you are under 50, you still active person, you still have your complete activeness, you can do exercise, physical exercise, you can run, you can walk. It's better you continue to use your exercise, physical exercise, you continue to use your diet, good food. Although some food can raise your blood glucose as well, but remember there are big difference between sucrose, but combination and glucose and fructose, that the same thing. Remember, this fructose is a little less dangerous for your health when you're diabetic than the glucose, because the most of fructose coming from the fruit, but even though they still raise the blood glucose, but you have more ability with your body to deal with this kind of raise. For example, when you let me give you a sample to be done with you, but I cannot to stay too long, that's you, but I just want to let you know. The deep study prove and confirm that the physical exercise and the diet are the two important, technique you can use to keep your blood glucose balance. I don't think about other metabolic disease like blood pressure, that's hypertension, like high cholesterol. So all of them can be, managed, but a little bit differently. May remember, all three metabolic diseases I just tell you right now can be managed better by exercise, physical exercise, and diet. Meaning your high blood pressure, you don't take any kind that can raise your blood pressure. You don't take anything, that can make it worse, and you keep your exercise. Let me give you a good example. For example, assume you have under insulin, insulin. That means he act a little bit really slow, may he stay longer in your organism. This is how they try to translate the term. So they combine, your healthcare provider combines, the insulin in maybe with maybe any kind of pill, maybe gluburide, maybe metformin, glycophage, any kind of pills, oral pills. You miss your ppm depending how your healthcare provider prescribe you your treatment. He can prescribe you that insulin, maybe 20 unit or maybe 30 unit, 8 in the morning, 8 in the night, and have blood glucose check twice a day, maybe 8 in the morning, 8 in the whatever, anytime prescribed by your healthcare provider. Do you see what I'm saying? So now you do it. Assuming you miss the 8 p.m. dose. You don't take the NPS down. You did not check your blood glucose before bedtime. Now you said no. You're going to justify the experience. Myself, I prove this experience. Many scientists support this kind, and then I would say again, many healthcare providers share the same advice about the blood sugar. High blood sugar experience in terms of therapy, especially long-term care therapeutic. What I take, you miss your 8 p.m. dose. Now you said, bon, because I miss my 8 p.m. dose of insulin and whatever and pill I have to take, I miss all of them, the 8 p.m. completely. You said in the morning you want to take your insulin. You don't want to double the dose, no matter how you're going to double the dose because of the missing dose. Do you see what I'm saying? Doc, you still need to keep the thing going the same way your healthcare provider prescribes it. Okay? But what happened? In the morning, which is a good experience, be with me, and I would like to do it. You leave it at 7. If you're an active person, maybe you're around my 45, 50, like my age level, you do, bon, I'm going to see what happens if you do exercise. Don't take the insulin in the morning. Don't take the pill in the whatever hypoglycemia you're on there. Don't take it. Now you just try to do this personal experience. You go at any place like club, any gym place, whatever you go in there, you can run. You run and walk. If you run fast, that's fine. You run a little bit slowly, you can run slowly. But if you cannot to run, you feel able to walk fast, you can walk fast. This is the best exercise. Run fast, run slow, and walk slowly. And then you will be surprised to see how big the difference is. When see how big the difference is, mean you will see what I'm trying to tell you now. You will justify or verify the reality with this kind of experience. You don't take the insulin in the morning, even you miss your insulin for 8 p.m. for the whole night. And then in the morning, you don't take your insulin yet. You don't take any, hypoglycemia, like, pills, oral pills for diabetes. You don't take any. Now you go to exercise. If you can run slowly, you run slowly for 30 minutes, maybe 30 minutes to 1 hour, as long as you can. But sometimes, as much as you can, I said, but the recommended time should be between 20 to 30 minutes. If you can do 1 hour too, that's fine. Or you cannot to walk, to run, you can walk. You walk fast. When you come back from your exercise, this is exercise, the physical activity now. That's why we try to educate person, when to educate you about, importance of education, like, physical education. How to use activity, physical activity, and what benefit you can get from the exercise. You will surprise when you just come from your exercise, maybe 1 hour or 30 minutes, as much as you can. I already told you that. So now you will check your blood sugar to see what level it is. If your blood sugar, mostly in the morning, is 150, 140, this is the range, our normal range or usual range. And you will surprise to see your blood glucose that morning, even you miss your your insulin 8 p.m. Even you miss any kind of other pills you have to take in combination or that combine with your insulin for your diabetes, you will really surprised to see how better your result is. That means your blood glucose check result for the morning. If, for example, your blood glucose range every morning is 150 to 160, kind of range. I don't know when you do, I can use another word. I really a little bit sorry about that, but I can tell you that. What happened? You will see your blood glucose, if really you do good exercise in the morning, usually the range should be 150. I'm telling you, for that morning, even you miss the insulin for 8 p.m. dose, even you don't take your insulin dose in the morning yet, you just do exercise, your blood glucose, I guarantee you, if you do that, your blood glucose check result will be surprisingly lower than 120. Even if you have your blood glucose range every morning at 150 or 140, it should be at least 120. Donc, I just want to prove you how important, how efficient the exercise and the, and the diet is important. Parce que the diet and exercise just continue to diet, exercise. You now, what happened? We have to do the next, our video. We'll talk about what kind of, what kind, of food you're supposed to eat, and that can, support your diet for diabetes to keep the glucose, balanced in the organism, and what kind of food you're supposed to eat, you're not supposed to eat. If I guarantee you again, if you try to put yourself on this kind of diet and any kind of food necessary, you can combine them together to see how you can continue to manage your diabetes with no risk, no any problem. You will have a good health condition almost everyday life with no problem. Do you understand what I'm saying? That's only what I bring for you today, my brother and sisters. And I expect you will be satisfied, and then now you have all opportunity if you want to follow all our video. And then with our video, you can continue to manage your diabetes, especially Haitian. I have two video, one in English, one a little bit in French, another one is Haitian Creole. It will be more easy for you to understand if you're Haitian, because we want to focus, you see what I'm saying? All our advice, all our, education, all our skill, we want to share with you in Haitian Creole to allow the Haitian, any Haitian level you have, you can be able to follow, des conseils là. C'est la veut dire qui ça nous veut dire par là. Nous appelons, nous gagnons trois langues, nous gagnons la langue française, nous gagnons la langue anglaise too. If you're a student, whatever, you're maybe diabetes, or you have any of your loved one, with diabetes, you want to help them, you will be able to do that, and we'll give you a link. You can go in our channel to pen the link, and you will be able to, to be satisfied with any question you may have. So, nous getting you welcome. Bye bye. We're going to welcome a second program we have for 15 minutes. So, nous quittons dans moment ça et nous aller ou joindre comme moi ou mettre ouvrir vidéo nous ou une vidéo en langue anglaise, une vidéo comme si en langue anglaise, like a little bit accent you can understand. You have another video with English, a little bit sophisticated accent, just in pronunciation a little bit. So this is for American people. You can see another video in Haitian Creole, pro Haitian Creole, you can understand, and then other one a little bit French too. If you understand French, you're a student, maybe you don't have ability to speak English very well or to understand English very well, you will be able to open it and then to see in French whatever question you have. I think you will be able to be satisfied. Okay, thank you so much, and then see you maybe next time.